Hello, my name's Marie and I'm a nurse specialist with the supportive and palliative care team at Nipro Blue Mountains. I'm going to talk to you today about a Surefuser, which is an alternative way of delivering a continuous subcut infusion in place of a NICI pump. I'm just going to talk to you about the components of the Surefuser. This bit here is the port which you remove in order to load the medication into the Surefuser. As the medication is infused, it goes into the balloon reservoir here and expands within the protective casing. And this one that's a 24-hour one, it goes up to level 5 on the gauge. This is the gauge here by which you can see that your medication is actually going down over the 24-hour period. We have the infusion line here, a clamp coming down past the filter, and then we come to the flow regulator. The colour of the flow regulator will vary depending on the duration of the infusion. For the 24-hour one or the one-day one, it's blue. So it indicates the length of the duration of the infusion and also the rate of the mils per hour of which the infusion will be going. It's important that this is secured firmly to the patient's skin with a strong dressing such as a tegaderm or an opsite, because the flow regulator ensures that medication is infusing at the correct rate, and this is reliant on contact with the patient's skin and the body temperature. Then down at the end here, you have the luer lock, which is disconnected and attached to the subcut line. As with the preparation of any medication, you need to be mindful of following the 5 rights and the medication policy of your workplace. For the purposes of today, we're going to be giving a continuous subcut infusion over 24 hours of morphine 10 milligrams and midazolam 10 milligrams. I'm just going to show you now how to load the Surefuser. The first thing that you need to be aware of is that you have the correct infusion device for the medication order. So this is an order for a continuous infusion over 24 hours, and this is the Surefuser that is 1 day or 24 hours. The next thing you need to do is to make up your sticker, your subcut infusion sticker as per your local area to indicate what's in your infusion. The next thing is to draw up your medications. So here we have our morphine 10 milligrams in 1 ml, and we have our midazolam 10 milligrams we've made up into 2 ml. The next step is to put this into your 50 ml syringe, remembering that when you are mixing medications that you need to check prior to doing this that the medications that you're going to administer are compatible. There are compatibility checklists that can be found to ensure this. Once the medications have been put into the syringe, you need to make up the rest of the syringe to 50 ml with normal saline. This needs to happen exactly to 50 ml. Once the medication is prepared, we then need to load the Surefuser. The first step is to engage your clamp, so bring it up towards the end of the bulb and put the clamp on. Then remove the luer lock cap and put your 50 ml luer lock syringe on the end. This doesn't need to be twisted too hard, it's just a gentle twist and it's on. Because of the negative pressure in the chamber, this is actually really hard to get the medication in, so you need to put the plunger on a hard surface and then you just gently but firmly push down, watching as it engages and fills up the balloon. You can see the blue line there is going along the gauge. When it gets to the top, it's at the number 5. And there you've got your Surefuser loaded. Once the Surefuser is loaded, you can take the syringe off. This is a one-way valve, so you can put it down, it's not going to flow back. Get the cap that comes in the packet, open it up, and then just gently take the syringe off and put the cap on. The next thing is to prime the line. So you remove the cap from the end of the line and release the clamp. The amount of time that it takes for the infusion to prime through the line varies depending on the type of infuser that you're using. Once you see the bubble of medication come to the end of the line, put your clamp on and then cap the end of the line in preparation for going to the patient. Now we're up to connecting the Surefuser. So take your Surefuser and your medication chart to the bedside and do all the usual checks. You come along to your patient Check your subcut infusion site that there's no signs of inflammation or infection, and then proceed to put the infuser on. Just with the Luer lock procedure, put the connection on. The really important step now is to secure the flow regulator. Remember I said earlier that this is important to ensure that there's the correct administration of the medication. I just need a friend to hold this for me. This needs to be secured with a strong dressing, keeping in mind that when you're putting it on, not to put the dressing over the dressing that you have for your subcut line. Simple tape doesn't work. These are quite strong and inflexible, the lines. Also, as people are starting to shut down peripherally at different times, they might be sweating a bit, and the lines do come off when they're just stuck on with the normal paper tape. So this is the best way to make sure that it's secured. With the positioning of the subcut line as people approaching end of life, as people will shut down peripherally, you need to just be aware to move the subcut line to a more central part of their body, as the flow regulator is dependent on their body heat. The next step is to commence the infusion. Undo the clamp. This is really important to make sure that the clamp's disengaged. There has been some issues in the past with this clamp where patients either fiddle with the clamp and turn it on themselves, or they may roll on it and accidentally engage the clamp. A way to ensure that this doesn't happen is to bypass the clamp by feeding the tubing through the clamp and then putting the clamp on. This way, the clamp's not going to engage and you have a good flow. Just to highlight this area to other nursing staff and to ensure that it's not going to be fiddled with again, or if it has been fiddled with, you'll notice. I just pop some tape either side. As you can see from this, we have the flow of the line, we have the clamp that's engaged, but we've bypassed the clamp. So this ensures that there's no way that this can be accidentally engaged and stopping the infusion. Now that your Surefuser is running, you'll be doing your regular checks as you would any other infusion to ensure that it's flowing right. So you're checking your site. In that too, you will check the line and check that the clamp is still not occluding the line. And then you'll come to your Surefuser where you look at your gauge. And just expect that this will be going down, following the blue line. This will be going down over the 24 hours. So when it's been on for 12 hours, you would expect that the blue line on the gauge would be at around 2.5. Once everything's connected, you put your Surefuser in the little bag, which comes with the packaging. Now it's important that the bulb of the Surefuser stays parallel with your subcut line. Whilst there is the elements that regulate this, such as the neoprene balloon and the regulator here, if it's too high or too low, it can affect the flow, either by increasing it or making it too slow. So this just needs to be kept in line with your subcut line. The other thing is to not let it get too hot, because that can increase the flow. So if your patient is hot, just make sure that it's above the bedclothes. Thank you for watching. I hope that you found this useful. If you have any problems, you can use the Surefuser Troubleshooter Guide. There's also information that comes with the product, or you could contact the Surefuser rep. Thank you very much. Bye.